in what way is holistic dentistry preferable to conventional treatment?
Okay, great. So what we're able to do with holistic dentistry is not just look at the teeth, but we're able to look at the overall human. So I'll tell you about some of the things that we do. One of the things we offer is biocompatibility testing. So usually you go to a dentist, if you have a cavity, you get the cavity cleaned out, you get a filling placed. In our case, we understand that people have different sensitivities and allergies. So we offer that service to do a blood test, which gets back and says, okay, these crowns are compatible. These composite materials are compatible, and goes down the list. So that's one thing where we're looking at the whole body and the whole human, because each of us is a little different. Maybe something's good for 90% of the population, but you're the 10% where you have a lot of reactivities. So that's one thing. We're also able to look at meridian connections to see how are teeth related
this
to.
is the exciting part for me,
Yeah, for sure. How are teeth related to certain other organ systems and how it may be impacting you, right? We have a lot of technology as well that traditional offices may have, but we're able to integrate all of it. So those are some major areas. We focus a lot on supplementation as well. So traditional offices are normally not talking about things like vitamin D, vitamin C, zinc. Now that you'll see there's more and more research and literature talking about this, I think 10, 15 years from now, even traditional offices will start recommending their patients when they're doing implant surgery, hey, is your vitamin D level good enough? If not, let's get that higher, right? If
I hope so.
Yeah, hopefully.
I mean, I feel like the science is already here, but they're not using it. And
That is true.
Why is that?
It's just, they're just like anything. If you talk about Tesla, for instance, the first few years, only the early believers bought in. It took 10 years before. The same thing happens with everything in science, especially science. It takes a while, but once there's enough research, enough people are talking about it, we're conversing, we get the message out, then more and more people start doing it. And there's a lot of publications, even within dentistry, that are talking about these things. So like a lot more dentists, people are now seeing that, saying, okay, even when it comes to gum disease, oh, it's not just let's do what's in the mouth, there's other things that you need to also take into account to get that patient healthy.
Yeah, of course. Well, because if you have gum disease, you have the correct environment for disease to be thriving.
Exactly.
And so it's not just about what's going on there, it's about what's going on in the rest of your body.
For sure.
So really important question, and I feel like a lot of people are going to want to know the answer to this, but what's the lowdown on fluoride?
For sure. So there's a lot of sort of myths and questions about fluoride. There's two different types of fluoride. Fluoride in our fluoridated water, it's not the same fluoride as a fluoride in toothpaste, okay? So that's why we're not a fan of the fluoride in water systems, because it's from pharmaceutical industry, some of the byproducts. Fluoride in toothpaste is a little different. Having said that, now there's plenty of research indicating even better options. So what we like to do is nanohydroxyapatite. We have two things. We have fluoride in toothpaste, but you have nanohydroxyapatite. The nanohydroxyapatite has no other issues systemically. It doesn't cause thyroid issues. It doesn't matter if you ingest it, there's no systemic issues, versus if you do too much fluoride, so that could be problematic even from a toothpaste. So as kids, for instance, children who don't have the ability to spit properly, we recommend no fluoride for the first few years anyways.
Because they're swallowing it.
Exactly. As adults, we think that stops. What we don't realize is fluoride is everywhere. So it bioaccumulates, and what we're trying to do is, if there's a better option, why are we not using a better option? So use the better option, and it even does a better job in terms of helping with sensitivity. So we have a lot of our patients, not just for cavity purposes, but even if your teeth are sensitive, the nanohydroxyapatite in different brands, it's really good for that as well.
Yeah. I'm so glad that we asked that. That was a good one. Okay, so what we're looking for is fluoride-free toothpaste with
nanohydroxyapatite.
Thank you so much.
That's what your teeth are made out of, okay? It's basically calcium and phosphate together.
Oh, okay. All right. Interesting. Okay, so what is the best way to treat cavities?
Good. So cavities is a multi-point issue. It once again, it goes back to health, right? So I'll start with diet. Everything starts with the diet. If you're eating clean, then even the bacteria that are thriving are only thriving that are good bacteria, that are the clean bacteria, versus not. So in terms of eating clean, what I always tell patients is eat 3 times a day, breakfast, lunch, dinner. Try not to snack in between, okay? Even if it's talking about sugars, give it a second. You want to just grab it? Or is it in the way, or it's...
I just...
It's probably okay.
It is in the way.
It is.
Thank you. Thank you so much.
Just stay there and look cute.
Thank you, thank you. And Dr. Chen wants that osteogenic... No, you're fine.
Thank you
Good.
so much. Oh.
Okay, you're good, Francesco?
Okay.
Go. So, you could just ask the question one more time. Cavities.
What is the best way to treat cavities?
For sure. So cavities, it's as I said, multiple things that have inputs into it that end up causing cavities. So step one is always diet and nutrition. If you're a clean eater, then less likely for the bad bacteria to grow because the good bacteria are being fed by the good food you're eating, right? So we're talking about if you eat good food, then you're also getting good vitamins and minerals versus if we're just eating crappy, if you're eating pizza and burgers, you're not getting the right nutrition either.
Well, it's like if you have cavities, you have the correct environment for the cavities to happen.
100%.
So it's not just about how do I feel the cavities, it's why do I have the cavities?
Yeah.
I wish someone had told me that when I was younger.
For
like
sure.
you have all these cavities because you have the environment for it.
For sure.
No one ever told me that. They just told me stop eating sweets. But when you empower your patients and people to understand why they're doing something or why it's happening, then we can come up with a solution.
For sure, 100%. So we spoke about that. Genetic is an aspect of it. So a lot of babies, their moms are tasting something, putting them in the baby's mouth, and now the bacteria is being transferred. So that's something important. If you, as a mother, you are cavity prone, be super careful when you have a child not to do that saliva transfer.
So if you're kissing someone that has cavities.
It unfortunately,
So basically, if you go on a date, ask them about their dental hygiene.
Yeah, it's true. To a certain extent, it's true.
I mean, I'd be looking at it, definitely.
And if you look at their dental hygiene, if their dental hygiene's good, they're probably good systemically too. It's a good correlation.
Well, if you have like bad breath, halitosis, it's often a sign of bad gut health.
100%. It happens all the time.
Yeah, absolutely.
So that's that. And then the last option, obviously locally, you have to brush, you have to floss. With that, there's a lot of mouth rinses and supplements you can use, but you have to do the local aspect. And then the fourth, go to the dentist, right? If all of a sudden you're just at home and you haven't been to the dentist in 2, 3, 4, 5, 6 years, you're not, even if you think you're cleaning everything out, there's just no way around it. You need professional help to get you healthy. So all four of those things, if you can do all that, you can minimize cavities and potentially eliminate them.
Yeah, amazing. Okay, so one more question off the back end of that.
Sure.
What about mouthwash? Because I see a lot of people using, brands that have alcohol.
For sure.
And obviously we have an oral microbiome. I feel like a lot of
100%.
people don't know that. Could you elaborate on mouthwash?
Sure. So as you said, we have an oral microbiome just like gut. And yes, the old traditional mouthwashes all had alcohol. Not good because it wipes everything out. You don't want to do that. You want to wipe away the bad stuff, but keep the good bacteria because you need good bacteria, okay? So yes, alcohol-free mouthwashes are the starting point of all of that. There's a lot of natural mouthwashes that have things like CoQ10 in them and other things that help, like some of the mouthwashes we like in the office. It's called Triology, okay? There's also something called PerioClear. If you have allergies, just look at the back of the label, just so that you don't have, if you have nut allergy, don't use a particular product. But yeah, those things help even more, okay? There's something called Tooth and Gums Tonic, so we really like to recommend that as well. You still rinse, swish twice a day, just like traditional mouthwash, but it doesn't kill all the bad, good stuff. It kills the bad stuff and keeps the good stuff there. One thing a lot of people ask questions about this, oil pulling. We like oil pulling as long as you don't have silver and mercury fillings, first of all. You can oil pull. If you have those silver and mercury fillings, then it's not something we recommend because it can leach out the bad stuff from those fillings. So if you don't have that, oil pulling is good. With oil pulling, what we like to do is, it's not something that we recommend stay on it forever. With everything, we want to your body has this innate ability to heal, right? So we want to activate it. So you do the oil pulling for 30 to 90 days, and then you can stop for another 30 to 90 days. Let your body do the healing and then reevaluate at that point again to see how's that healing. If your body's done fine, then you can do what you're doing. You don't have to keep oil pulling.
Yeah.
So, yeah.
That's good. That's golden information. I didn't know that about the mercury fillings and the oil pulling.
Yeah, it sort of leaches out the bad stuff. So you want to be a little careful.
There we go. Okay, so I feel like we're nearly done. There was one more question I wanted to get on. Oh, this was the important one. So what is the difference between a zirconian implant and a titanium implant? Like, why would someone go to a holistic dentist instead of going to a standard dentist when it comes to root canals and implants?
For sure. So titanium, as it sounds, the implant is made out of mostly titanium. We call it grade 4 titanium, but there's always trace amounts of other metals in there, okay? Once again, a lot of the population is not allergic, but we do have the subset of people who are allergic. That's one aspect of it. The second is you're putting a metal in your mouth, okay? Just like any other metal that you see, if there's a pipe outside, if there's rain, this and that, it corrodes over time. In your mouth, you're constantly eating food, there's acids. Similar thing happens where over time, that area has the ability to corrode, and then the titanium particles start coming off the implant and get embedded into the tissue. Once again, we've been using it for a long time. For many people, it's very successful titanium implants, but I always like to say there is a newer alternative comparatively. For the last 20, 25 years, we've been using zirconia, and it's healthier. Because it's zirconia, there is no metal, there is no titanium particles that are coming off. Like I was explaining to you earlier, the ceramic implants sit above the tissue. Your tissue really likes the zirconia implants. They're biocompatible, of course, and this bacteria actually adhere or attach to the ceramics a lot less. Having said all of that, what does that really mean? It's a healthier option. There's no metal. You don't have to worry about sensitivities and stuff like that. And long term, it's not going to cause anything such as peri-implantitis, which is inflammation around the implant. Yeah. Because the implant's neutral. There is no metals to interact with.
So what would you say to someone who already has a titanium implant? Is it a case of, I need to get this out, or is like, if it's okay and there's no symptoms, you just keep it in there? What would the ideal scenario be for that?
For sure. So I like to make that specific to each patient and each individual, right? So not a blanket statement. Having said that, if you have a titanium implant, I'm not going to just say take it out, okay? If you have it, it doesn't bother you, you don't have any systemic issues, look at medical history and all of that, and there's no issues, okay, that's one aspect, keep it. Also, with all that, it also depends what type of lifestyle you're living. Everything has to work together. Just me removing titanium implant, and if we don't fix everything else,
junk food and don't look after yourself,
it doesn't make sense, okay? Now, if you do have allergies to it, like we do the biocompatible testing, of course, that's one thing. If you have infections around the implant, the titanium implant, of course, you want to treat that. Sometimes you're able to save that, but if not, you replace it with a zirconia. So in that situation, you replace it. We do have patients who do come seek us out because they have allergies to titanium. We do specialize in carefully removing them, and more often than not, be able to place a zirconia immediately into that spot. All those patients that we've done that, they feel much, much better, much lighter. Once again, it's not something where I'll say, hey, everyone should go get their titanium implants taken out. That's not the case. If you have specific reactions to it, go to your dentist, ideally go to a holistic dentist, let them evaluate that, evaluate your medical history and everything, and see if it's something you need or not need.
Yeah, I appreciate that, because it's not, I don't think it is one size fits all.
Yeah,
I think it's like, if you intuitively feel like there's something coming up for you, or there's something wrong with your body, or like me, and you're like, I'm doing all these things, there's something still off, and you can do it, then do it. But I think something that surprised me as well is like that you guys do monthly payment plans, and you can there's other ways to do it. I think people see the price tag of, this is what you have for dentistry, but there's ways you can break it down, there's ways that you can make it achievable.
I think that's extremely important, because a lot of patients sometimes look at a zirconia implant or look at this and they just see the number, and it's a little bit more expensive than traditional methods. But one, we always tell patients, it's an investment in yourself, in your health. Yes, you're using better materials, and of course they're going to cost more money just to manufacture them. With titanium, there might be 200 companies, all different manufacturing processes, all different metals that they use to manufacture, versus ceramics, there's not so many. There's only a few handful 5 to 10. And of that, like in the office, we use Swiss Dental Solutions, the best in the market. They've been there for 20 years. We really like using those implants because the long track record, right? Of not just it's healthy for your mouth, it lasts as well. Because you want something, if you're going to spend $5, $10, $15,000, you want something that's going to last you many, many, many years.
Yeah. Okay. Amazing.
Cool.
Thank you so much.
No
Amazing.
Okay. You're done?
Storage was full right at the end there, but there's somebody coming in as well.
Okay.
No, that's
problem.
perfect.
Yeah.
That was really good. Really helpful.
Are you still there?